BRCA testing is a genetic risk cancer assessment tool that we use at Elite Women's Health for women who are at high risk for developing breast cancer. So if you come and you have a visit, such as your annual exam here at Elite Women's Health, we will look at your family history and we will identify if you deem to be at risk for developing breast cancer, meaning you're at higher risk than the normal woman in the general population of people. Not every woman is the best candidate for BRCA testing. Women that are great candidates for BRCA testing would be those at higher risk because of familial history, meaning a first-degree relative such as a mother, sister, or daughter. This test isn't designed for everybody, but it is designed for patients who are at elevated risk for breast cancer. And then we get into the bulk of your history and we identify who else could be carrying this genetic component. After counseling here at the office and an in-depth conversation with the patient, we decide if that's a great fit or if this is a good test for them. Result turnaround is 3 to 4 weeks. And we do tell them, this is not a quick turnaround time. This is 3 to 4 weeks of waiting anxiously, but it's well worth it to get a negative test. And if your test comes back positive, then you know and you're empowered with what steps you can take to prevent your risk of cancer. If the test comes back positive, it puts patients at a greater risk of developing breast and ovarian cancer. So we will work closely with referring them to a breast surgeon who will help us. We will co-team with the breast surgeon in determining an individualized plan for that patient moving forward. If they come back negative, I bring them back and we talk about what type of screening assessment and what sort of screening program we're going to use, and if they're going to develop cancer, how we're going to catch it at an early stage. Here at Elite, we want to offer patients tests that will empower them and help them develop an individualized plan for their health care. You can't choose if you're going to get cancer, but you can choose if you're going to get a test that will help you figure out what kind of protocols to put in place to catch cancer early.